Hi, welcome to the audio blog of carpal tunnel syndrome or CTS splints. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington, your local South Puget Sound chiropractor, Seattle, Tacoma, Washington. Oftentimes, wrist splints can be beneficial for some of the self-care that you can do on your own. And this typically assists in relieving the pressure that's caused by the carpal tunnel that is restricting the area when you bend your wrist forward and backward. We call that flexion extension. Because we cannot control that position during your sleep, there's pressure onto that nerve, and it especially worsens when you bend it forward or backwards. Therefore, the splint is being used during sleep. I know there's a number of people or patients that tend to curl up or tuck the sheets with their wrist as well, so being aware of that. There's hundreds of options for splints that you can find online and range from a type of glove-like splint and with or without fingers to a full arm splint. And the majority or the purpose of that is to block that type of motion. And you can use the Velcro type closures, and some have metal bars at the bottom or the top of the splint. Your chiropractor or myself can definitely choose the best splint for you in particular that feels in comfort. So you have to ask yourself some of those things. The primary thing that you can do is limit motion. There's studies that have been out of the report of 2012 Cochrane report that involves smaller sample size type splints, drawing conclusion that healthcare providers mainly approach it from different angles and use different products, in keeping from surgery as your last resort. And that's, finding those type of treatments is definitely, or treatment option has the many multifaceted approaches, and there's no one right way to reduce that. And what I share with patients is typically looking for the least invasive procedures to the more invasive. Typically, non-surgery management is the best option, and splints, giving it rest, modifying your job, looking at ways to reduce inflammation or anti-inflammatory measures. This can include ice, use of prescription medications, vitamins, herbs, even physical type modalities that can be used: cold laser therapy, manual therapy, and manipulation and mobilization. Those are the things that you can look at to help with some of those symptoms when it comes to taking care of carpal tunnel type syndromes. Care also focuses on relieving, and here's what it is: relieving that pressure on the median nerve and in the other anatomical locations. That includes the neck and the shoulder, where this nerve courses out and can create carpal tunnel symptoms. What I've noticed with carpal tunnel symptoms is that many times a patient will have a problem going on in their neck first. That's where the origin is, to coming down into their hands. So treatment plans can vary, and also these conditions can build up types of pressure from other type of symptoms that are going on, such as diabetes, hypothyroidism, and it could be a multifaceted approach, but multi-challenging in managing the condition, especially when the patient has waited for years to make these changes or possibly seek help. Thus, the best possible outcome for a chiropractor is to evaluate your wrist, hand symptoms sooner rather than later, and making sure that you get the best care as quickly as possible. I'm Dr. David Warwick at Warwick Chiropractic in Lacey, Olympia, Washington. You can call my office at 360-951-4504. You can also visit my website at drdavidwarwick.com. On my website, you'll see some exercises and stretches that you can do as part of some of the health self-care as well to help and assist you. You can also schedule an appointment online or walk in as a new patient in the office. So I'm Dr. David Warwick. Thank you for listening today, and I'll see you soon.